Hi, everyone. This is a paper out of the New England Journal of Medicine. Again, New England Journal of Medicine is one of the most widely respected journals in healthcare. And this is not a full paper, but kind of a letter of correspondence from UC San Diego talking about the resurgence of SARS-CoV infection in a highly vaccinated health system workforce. So, what UC San Diego did is they have a healthcare workforce that is about 87% vaccinated. So most of their healthcare team is vaccinated, and what they've been doing surveillance on all their healthcare workers by testing them regularly with any signs or symptoms, and so they are able to calculate what the symptomatic infection rate within their workforce is over time. And so if you look at this graph, what you see is so most healthcare workers in America had access to the vaccine beginning in about mid-December. So people who wanted vaccination got it fairly early. The people who didn't get it, they're not going to get it. They had access to it. If they haven't got it by now, there's reasons why they're not getting it. As you can see, from March till about June, there was a very low number of vaccinated workers that got infected, and there was a relatively low number of unvaccinated workers that became infected. As you can see, the absolute numbers of vaccinated workers that got infected was 70, unvaccinated workers were 56, which makes it seem like vaccinated workers were getting infected more, but you have to understand that 87% of the people were vaccinated. So if you had it, so there's 87% of the workers are vaccinated, so you should expect 87% of the infections to be in vaccinated people if the vaccines didn't work at all. So you would expect this number to be more like, 100, and this number to be more like 15 or something like that. But you notice that in June, with the advent of the Delta variant, you see a large spike in increase in both vaccinated and unvaccinated workers. And so the thing that they found out was that symptomatic infection was a little bit more common in unvaccinated people, 89% versus 83%. And then when they tested vaccine efficiency in the real world in their healthcare group, so vaccine efficiency was over 90% from March until June, but then fell to 65%. So by the time the Delta became popular, in San Diego, vaccine efficiency had dropped from 90+% to 65%. So it's unclear if what this paper doesn't tell us is the decrease in vaccine efficiency because Delta is just so much more infectious, or two, because the number of the antibody titer has been falling since they were vaccinated in um, in January and December. It's been generally falling, and now it reached the point where it's not enough antibodies, or if it's because California lifted their mask mandates and other non-pharmacologic measures, and that's why we got more infection. That seems unlikely because that would have affected vaccinated and unvaccinated workers equally. Um, So it's probably has more to do with either waning immunity or the Delta variant, or most likely a combination of both. But what it does show you that in real world effectiveness, the vaccines were 90% effective in the San Diego healthcare system from March until June, but has now fallen to 65%. So this is why people are talking about the boosters, and maybe I'll make a video about the rationale behind boosters later. But this is one of the reasons that they're thinking the boosters might be helpful, because there is this falling of vaccine effectiveness um, over time, and especially with the advent of the Delta variant. And it looks like in unvaccinated people as well, the Delta variant is definitely more infectious as well.